in the studio. Kids do that.
All set?
Okay, thank you very much. Good afternoon. Today is Wednesday, September 17th, and it is 1 p.m. I'd like to welcome everyone to the Health and Human Services Committee. Travis is unable to attend today, so I'm going to be your chair for the meeting. We're joined today with Dan Nolan, Randy Brown, Amanda Champion, and myself for the legislator, and Jenny Sutcliffe, who is our commissioner for Whole Health, and Corsa Kumfi, who is our county administrator. I'd like to go ahead and call the meeting to order. Are there any changes to the agenda? Okay, I see none. We do have one person here with us in the audience. Do we have any public comment today? Okay. They have said no. We do have some meetings minutes to approve. August 20th, 2025. Can I have a mover, please? Moved by Dan Nolan, seconded by Randy. Are there any questions or comments or changes to those minutes? Okay, all those in favor, please raise your hand. Okay, that's approved. I do not have a chair's report other than to say that we are in the midst of our expanded budget meetings, and so we're all pretty exhausted at this point. I want to keep it pretty light for this meeting, but our departments that have come in so far have really done a great job of presenting their budgets, and I think we're about halfway through, and we're definitely going to have to make some hard decisions this year. Corsa, would you like to do a county administrator's report?
Yeah, so a very quick one. I announced this morning officially that our Chief Equity and Diversity Officer will be leaving us, unfortunately. We thank her for her service. She will be staying on until the end of the year event. We are really excited about that. County administration will be working with Human Resource to inform the committee of the process leading to seeking a replacement. We are in a similar situation with Director of Human Rights. We are very close to finishing up, cleaning up some few things with Human Resource. An announcement or posting of the position will be done in due course. I believe there are a few elements of process adjustment that we are hoping for, but I will sit with the committee potentially next month in executive session to discuss some of your expectations as we move into filling both key positions moving forward. Also, as I announced yesterday, we have an agreement with Volunteers of America of Upstate New York to assist us with developing the Cherry Street shelter. We are also in similar conversation with them on other things and helping us with the broader shelter services. So that conversation is also ongoing, and as soon as we establish an agreement, we will also announce how we intend working together in other areas of our shelter services. Yeah, so that's my report.
Okay, are there any questions for Corsa? I actually have one follow-up question. I wanted to see, towards the end of last year, we had actually talked about an advisory board for the Department of Social Services. And at one point we had an advisory board. I don't necessarily know if it was called advisory board. And there was supposed to be some research into if we were able to have one, who it would consist of. And I wanted to see if there's any follow-up with that.
Yes, I think where we landed was that if we want to form an advisory board as it is known before, it is at the discretion of the Commissioner of Social Services, and the Commissioner appoints the members of the advisory board. The legislatures, I believe, Katrina will be able to help me. The legislatures can set up an advisory board that will not have any policy oversight on social services. During the interview process with Brittany, she also expressed interest in that community engagement in establishing something if the need be. So being a new commissioner, I believe she's trying to get her feet wet on what the needs are, and we will get all of you involved as the process moving into what the expectations are going to be. What I'm excited about is she kicked off her tenure with engaging the community, working with HSC and other nonprofit organizations to see how we can work together better. And that will inform us how we move forward in setting up any of those processes. What our hope is not to put another tentacles that will prevent us to be able to provide the services, but to be able to make sure whatever structure we put in place will support quality service delivery to the residents. I think the most crucial element of all of the discussion is how is the interaction between residents and social services. And we just want to make sure, and also Brittany, I think she said she'll be able to assist me. She's made it clear to me, community engagement, openness of social services, and bringing the services closer to the people is what she wants to see done, and also to bring some degree of transparency at social services and making sure that clouds of secrecy is removed, and social services really what it is, social services. So yes, I think it's a good idea that we have a community input in the processes, but we also need to make sure that it is effective. And I believe that over time, it should be able to assist us in that direction.
Okay. I just want to get an idea from our committee members if this is something that we would like to see from this department so that there's consensus. If you could raise your hand if you would like to see this at least pursued or more conversation. Okay.
Yeah, I mean, maybe Katrina has something to add.
Yeah, Katrina.
I was just going to add more of the procedure. If we were to establish an advisory board like this, it should be done by resolution. Similar, the most recent one was the establishment of the case board, and you could do it for a time period. But I believe that part of the process that we were discussing earlier was to wait until the commissioner's position was filled and move forward after that with the new commissioner's input.
Okay, great. If we could possibly add that as a topic for next month's meeting, that would be wonderful. And actually talk about the structure as well as who we would like for members, the number of members. I think it is going to be really essential to have peers and clients that are part of the advisory board. And then, of course, Brittany's input is going to be really essential for us to move forward too. So, okay,
Absolutely.
Great. Brittany?
Yeah, I just want to add that I'm on board with the advisory board. It's something that I am interested in. So I'm glad you raised the important topic. And along the lines of what Corsa was saying, that, my goal is to start implementing community outreach and engagement and start engaging our community and our clients in conversations around social services and the way that we interact with the community. So thank you.
That's great. Thank you. Okay, let's see here. We'll move on to the whole health department. And we do have a resolution, authorization for Tompkins County Whole Health Department to enter into a multi-year agreement with Bernie Bus Services Incorporated, ID 13520. Can I have a mover, please? Moved by Randy, seconded by Amanda. And Jenny, would you like to talk a little bit about the resolution?
Yeah, absolutely. So this is a service that is part of our Children's Special Care Needs Division, which for lay folks is what we usually think of as early intervention programs. And so this is a transportation service who takes preschool-aged children who qualify for the program to and from their home or daycare to the program at Racker. So basically, it's a busing service that would pick up preschoolers from their daycare or if they're in a pre-K program and take them to Racker so that they can receive their early intervention services. We've actually held this contract with Bernie Bus for the last 7 years, and we did RFP it, and they won the bid, so we're renewing this contract with them.
Great. Any questions for Randy Brown?
I've seen the Bernie Bus all over, and I was curious, who they were transporting. So I assumed it was students. I didn't realize that, I guess I missed the county actually had an agreement with them. But it's good to know. The question I had was the rate, and is this something that comes out of county funds, or is this something that comes from state funds, or is it a little bit of both?
I'm going to punt that one to Jess, who is the division director for that. And thanks for joining us today, Jess. She's online.
Hi, yes. Can you all hear me?
Yes.
Okay, perfect. Yes, this comes out of county funds. And since they are a for-profit organization, they can determine the rates themselves. We do get a reimbursement of 59.5% of our transportation costs. We are reimbursed some for the cost that they propose. The other school districts transport their own children at a much lower rate than what we are contracting with Bring Bus.
Thank you.
Any other questions today in regards to the resolution? Okay. All those in favor, please raise your hand. And that is unanimous. Thank you. Jenny, do you have any other updates for us today?
I do. First, I would really like to highlight and sort of applaud our department and their really quick response to the changing landscape around COVID-19 vaccines. My team was really quick to, try to understand what was happening at the federal level, decipher it in a way that was a little bit more digestible for community members, reach out to partners to understand the work that they were doing and how we could collaborate. And we, I think we did a great job really posting what we knew as quickly as we knew it. I think we're trying hard to practice good communication, be first, be right, be credible. So we got what we knew right away on our website, and then we are working on an FAQ that contains more detailed questions that have come in from the community. We've kind of compiled those. We're making an FAQ, and that'll be going on our website soon. So I just kind of wanted to highlight that great work. We participated in Airport Day. That was wonderful. It was so fun. I actually took my kiddos. They loved it. So just wanted to sort of applaud the county for that. It was a really wonderful day in partnership. And then we recently applied and received a couple of grants that I would like to highlight. The first is a grant that was awarded from the Park Foundation, which will support a doula training initiative through our Healthy Infants partnership. This one's particularly unique in that it looks to host a doula training for a cohort of Black women in our community. This is something that came out of work that our Healthy Infants partnership has a community advisory board. And in partnership with their community advisory board, the need for this was identified and this proposal was kind of generated. And so it's a strong partnership with our community advisory board members, Tompkins County Whole Health, the Ithaca Doula Access Initiative and Collective, and several other community partners. So we received this grant. My understanding is that this work won't still start for a while, but we're really excited about it. The next one I think you all sort of touched on yesterday in your meeting, which is the passing a resolution which authorizes us to apply for up to $1 million of a residential septic system program. We have had this grant in the past. It is a federal grant that comes through state pass-through dollars. And we're reapplying. This is a partnership that we have with INHS. They actually administer the program. They sort of track eligibility, and then our environmental health team plays our role, which is designing septic systems, testing them, things of the like. And so we will be reapplying for that grant. Those are sort of two funding streams that I wanted to mention. And then the last thing is a little bit of a teaser, if you will, for our budget hearing next week, but I wanted to raise to you all. We're so thrilled that there has been included in the county administrator's budget the role for an epidemiologist for the health department. This is not something that we have had before, and I think will be tremendously valuable. I've only been there for about 2 months, and my list of projects for an epidemiologist is probably already at like 8 to 10. Our staff have many use cases and needs, and they've been bringing ideas, and so we are really excited to see that that is included in our recommended budget, and I wanted to share that with you all, and you'll hear more about this next Thursday at our budget hearing.
Wow, awesome. That's great.
So those are my updates.
Great. Any questions or comments for Jenny?
Thank you very much. You guys do fantastic work. That's all.
Thank you.
Amanda?
Yeah, I was just going to ask, as you've been here for 2 months. How's it going? And is there anything that the legislature can do to further support you going in your new role?
Yeah, thank you. That's a great question. I think it's going great. I sort of joke like we should ask my staff if they think that too. But no, I mean, it's been a wonderful welcome. It's been a wonderful welcome both within Whole Health, also sort of across the county. As of tomorrow, I will have actually been able to sit down with almost every smaller program at our department. So I sort of started out with leadership, and then I've also worked my way through and sat down with every program that we have to kind of understand their challenges, their successes, what they hope for me in my role, how they feel like I could be supportive to their work. And so that's been really wonderful getting to sort of understand their work. I've also had the chance to sit down with a lot of the county leadership, and that's been great. And in terms of support, I think I have a lot of ideas on how I want to bring more of the health department to you all. One of them actually includes, I think, probably starting next year, sort of just respectfully, Amanda, when we have a new legislative body in, bringing one of my division directors to each of these meetings. And so that they can just, when the floor is mine, they can actually have a little bit of a chance to talk about their work, and you can get to know them and see who they are and the important work they're doing. So that's on my radar to kind of do that in January. And then we're also at the moment, starting the process of putting together a robust legislative briefing document for incoming legislators. So I guess that doesn't really answer your question in terms of what you can do for me, but I think granting us an epidemiologist is the best thing you could do for me.
That's great. And, I think sometimes, we were so focused on COVID for so long that I think it is easy to forget about all the other amazing things that your department does. So I think having, somebody come in and give little updates on different, projects is great.
Yeah, and there is one other, just so it isn't just disease control focused, we do have another piece that's recommended in our budget for the suicide prevention coordinator. That's to support some work for a suicide prevention coalition that works. So that's also recommended in the county budget, and you'll hear more about that too. That's sort of on the mental health side. But we have a lot of work for the epi person also in the mental health space, particularly around opioids.
Wow, thank you.
Yeah.
That's awesome. I'm very glad to hear about that new position, especially I was watching the hearings today, and I don't know why I do that to myself, but it sounds like there might be some of our friends on the federal level that could be looking for jobs. So it'd be wonderful to recruit one of them. But also, it was somewhat alarming that they're talking about taking the MMR and Hep B off of the children's vaccination schedules, which could open up definitely a can of worms here locally for our little ones. I also, it's interesting, my son tested positive for COVID Sunday after a weekend of me telling him he was absolutely fine and to get it back on the ice and play ice hockey. And I texted Dr. Dindali, and for people that have COVID right now, you don't know what the protocol, it's very unclear what the protocols are. And then, so I did go on the county website, I looked at ICSD's website, and there's really, there's not much out there because it's, we're kind of in a weird spot right now. And so what I found though is that for the school districts, they're just doing it essentially like if your child is fever-free for 24 hours, if they're symptom-free, they can go back to school. So it was good to see that information.
Yeah, and I think, our best guidance is always stay home when sick. Yeah. Stay home if you think you're sick. Stay home maybe a little bit after you've been sick. And then, I think following sort of traditional 24-hour fever-free is good. And, if you're feeling sick and you need to go somewhere, it's not a bad idea to put a mask on in public. There's still people that are doing that. And that's certainly also an option that's available.
Yeah, great, thank you. As far as the wastewater, are we still testing wastewater to see what our contamination levels are?
That is a great question, and I don't know the answer to that off the top of my head, but I can find out and get back to you.
That's great, thank you. Any other questions or comments? Okay, thank you so much for showing up in person. It's always nice to see people here in our chambers. Next, we have the Office for the Aging, and I see Lisa Monroe is here joining us. We do have a resolution, a budget adjustment, Tompkins County Office for the Aging, budget increase to the Long-Term Care Ombudsman Program, ID 13521. Can I have a mover, please? Moved by Randy, seconded by Amanda. Hello, Lisa. Nice to see you.
Hi, and I apologize for not being there in person. We have NYSOFA representatives in our office today doing our program evaluation, so I'm kind of just staying close. Yes, so this resolution, it's a budget adjustment and a budget increase to our long-term care ombudsman program. It was a legislative add to the governor's budget, some leftover ARPA funds, it looks like. So that increased our budgeted amount by $81,028 for the budget this year, and it pretty much eliminates the county costs that were put in there. So it's saving the county a little bit of money, which we try to do every time we get extra funds. So it's pretty much it.
Okay, any questions or comments for Lisa? Okay, all those in favor, please raise your hand. That is unanimous. Thank you very much. Lisa, do you have any other updates for us?
Yeah, the only thing I wanted to mention is the senior farmers market coupons booklets that the program still runs till September 30th, and we just got notification last week that we're able to do a second issuance of booklets to try to get rid of them. They did give us more this year than in the past. So if people did already get one book, they can get a second book this year up until September 30th. The coupons can be used up until November 30th, but the program stops giving them out on September 30th. So tell everybody you know that can qualify for that to come see us.
That's great.
Or we'll see them. Either way.
Great. I guess I had a question in regards to the move to Dutch Mill. Have you received any feedback from our community about the move for your office?
Yes. Yes. Not directly. I mean, I have not directly asked anyone. I don't think they've been directly asked, honestly. My advisory board has some questions, and I think that they'll be able to be answered on Friday. They're meeting with Amanda and Dan, so I hope that helps bridge that gap a little bit. But we've heard bits and pieces with people, just anecdotal things, and then we've people that have walked in a little sad that we're going to be gone, but that's about it. I haven't heard much more than that.
Okay. Great. Any other questions or comments? Okay. Thank you, Lisa. Appreciate it.
Thank you.
Let's see here. We have other departments that are joining us today. Brittany Earle, the Commissioner for Department of Social Service.
Hi.
Hi, Brittany.
Sorry, I can't be there in
nothing's
person.
going
They're also butting up back-to-back meetings.
Nothing's going on with DSS, right?
Yeah, especially this week.
Yeah.
Share some roadway numbers with the shelter. We have 42 individual adults in shelter right now, 3 families with a total of 8 persons. And in other hotels within the county, we have 30 individuals and 1 out of county. So like Corsa said, we are partnering, we're moving to Cherry Street for Code Blue, and we're partnering with VOA on that, so that's exciting. I wanted to make a comment about a public comment that was brought up last night with Code Blue with the wet versus dry shelter. I think that's a really valid concern, and VOA, I think, is really well equipped to be able to address this concern. So I'm excited to bring that back to them and have a discussion with them about it. So again, I appreciate that public comment was raised. And then, let's see, internally, we're rolling out a mission, vision, and values project that's rolling out this week for the department and all staff to start contributing and participating in. I've been actively working with community partners and agencies, with Human Services Coalition recently on a SNAP focus group, which Cindy had mentioned in her budget presentation. So that will be forthcoming. Like details, plans, who will be coming to the table is not officially worked out yet, but it's in the works. So that's exciting. I think it's good for agency partners and community members. And then yeah, I'm excited to start collaborating more with the community. And in saying that, I will need the legislature's help in coming to each of your districts, and where I could come and be for a couple hours in the evening to connect with your constituents and have discussions about DSS and what's going on.
That's great. Thank you. Any questions or comments for Brittany? I guess I had a question in regards to the philosophy of VOA and you'd mentioned the wet versus dry, and was wondering if you can share a little bit about that.
Yeah, so Code Blue is a low barrier shelter. We can't turn someone away who, if they come in, having drinking alcohol, using drugs. However, I will say that the Cherry Street location is a very large location, and I think there is an opportunity there where we could be more intentional about intaking people for Code Blue and kind of separating the wet versus the dry. And we're also thinking of other ways that we could work with other community agencies to address this issue, to either help them sober up somewhere and come back to shelter. So that's in the works. I can't give too much information on that, but VOA, again, they're equipped to be able to, let's think through how we're going to have clients from both backgrounds coming into the low barrier Code Blue shelter. Let's think about how that could look. And again, they have expertise in this, and I'm excited to be able to partner with them to address that issue.
That's great. Thank you. Also, maybe something that's been floating around too is that families would be at the Code Blue shelter, and many times that's really not the case because we try and shelter them at a different location where they can stay together and have a little bit more privacy. Is that correct, Brittany?
So Code Blue is for adult individuals. Families would still need to be housed in motels.
Okay, great. Randy?
This is a question for more than one person, I think. The Detox and Stabilization Center that's slated for Trip Hammer Road, Frank Krupp had reported on that a couple of months ago, and they were aiming for December. Have you heard any more about that happening?
I have, but I can't say. I think that sounds right. But I can also follow up on that with with an updated timeline from them.
That'd be great.
I think it's so important and
100%.
Need it.
Yeah.
Thank you.
Great. Thank you so much, Brittany.
Welcome. Thank you.
Okay. Next, we have Kate Shanks Booth with Youth Services. Hello, Kate.
Hi. How are you guys doing?
Good.
Just a couple things. I had reported a couple of meetings ago that we had applied for a juvenile justice grant hub for the South Side was going to be our lead, and we'd been working with probation and DSS and some other community partners on that. Fortunately, we were notified that we did not receive that grant, but we were competing in the urban, which means all of the contiguous counties around us were in the rural setting, and we were put into the urban. So we knew it was sort of an uphill battle when we submitted. But the good thing that's come out of that is that we are having meetings internally and externally with our partners to make sure that we are having a more organized and holistic response to the youth needs that are emerging in the community. So I just wanted to highlight that work and thank the partners that helped us on that grant submission. It was a lot of work, especially Mona from CJC and Siobhan from Southside. They did a lot of work on that. So thanks. And the rest is just budget. We're looking forward to seeing you tomorrow night. See, one other thing, I just put in a request to fill the vacancy. We had hired a youth service specialist. Donovan Birdie was a former DSS security guard, and he came in with some great computer skills and helped us update our website, and we were really making a lot of progress on that. Fortunately, he accepted a job in California, and we lost him at the end of July, so we're going to be posting that. So if you know anyone who is good with computers, data collection, and likes to help find efficiencies for our department in that way, send them my way. Hopefully we'll be posting that pretty soon. So that's what I got.
Okay, thank you. Any questions for Kate? Randy?
Hi, Kate. I exchanged emails with Brandy at BOCES, and I've forgotten Brandy's last name, so I apologize. But she's
Remington.
Right, and they were having monthly meetings about, I think part of it is vaping and those kinds of issues are what they're working on. But also it's like a mental health group. They meet like to discuss all youth issues once a month, or are you part of that?
Yeah, so I'm the co-chair right now with the Youth SPOA coordinator, Katie Farrell, I believe is her last name, that's out of Rackers. And so that's the Collaborative Solutions Network. So we're working closely with the mental health department and other folks who deal with youth needs, particularly in the mental health area, to see if we can collaborate and fill different group or needs in the community. And Brandy has been an active part of that. There was a prevention group, a subgroup of the Collaborative Solutions Network, and there was also been an organization in the community for a while, the Coalition for Healthy Youth, CCHY. They have merged and are working on vaping in particular, and they're working on a lot of other mental health issues as well. So yes, we're a part of that, leading it, and we're really looking to sort of do a revamp and a reboot. One of the major issues in that CSN, Collaborative Solutions Network, over the last few years has been, our leadership in the county has been really busy dealing with the COVID pandemic, and the DSS commissioner dealing with other things. And so now that we've got Jenny and Brittany, on board, we have set a meeting to say we really need to have a lot of community buy-in from the county leadership in particular to make sure that we're having staff and that we're putting resources behind the most present needs for our youth. So more to come on that, but yes, we are involved, and it's a really good group.
Great. Thank you.
Yeah.
Any other questions or comments for Kate? Okay, Kate, thank you so much for attending today.
You got it. Sorry I wasn't there in person. Thanks.
It's all right. Next time. We also have Cindy Wilcox from the Human Services Coalition. Hi, Cindy. Long time no see.
Hi.
Technical difficulties. Hey, there we go.
So many. My internet's super janky today. I tell you, it seems to be completely coincide with HHS meetings. That's when my internet starts to fail. I'm not going to take that personally. Hello. I have one quick piece of information. As you all know, one of HSC's programs is the Health Planning Council. It's a network or a forum of health-related organizations that work together to ensure kind of collaborative effort around some of our community's healthcare needs. Tompkins County Whole Health is a very important partner in that council. The council is in the process of reviewing their structure. The kind of definition of health, as you all know, has evolved pretty significantly in the last couple of years to finally folks understanding that health isn't just clinical health, going to the doctor type of hospital services health. It encompasses more holistic view of health. So mental health, food, some of the social care needs, transportation, access to healthcare, housing, all of these things impact people's health and well-being. So we, as the Health Planning Council, are kind of looking at how we can best structure that council to meet that evolving definition of health. So we're kind of doing some retreaty type of work to identify the structure of that and the membership to really better represent that definition and also better advance the goals that are evolving in a lot of our kind of overlapping health plans, right? So Whole Health has our community health improvement plan, and the hospital has their health improvement plan, and Health Planning Council as HSC as a rural health network has their plan that we have to submit to the state. There's so much overlap, and that's really where kind of the Health Planning Council sits. So how do we better collaborate across those plans? I've had conversations with Jenny and Brittany, of course, and everything kind of comes together there. So it's really exciting. I think it's going to be a great opportunity for us to kind of see more clearly our shared goals around health.
Great, thank you. Any questions for Cindy? Randy Brown?
Yeah, hi, Cindy. Going back to your budget, in the items that were being cut from your budget, could you share with us in just an email form, which ones are like food related, which ones are, you gave a nice spreadsheet, which I did go through, it was all that detail was there, I appreciate it, but it talked more about like, this is part of the community plan, those kinds of things, but I'd really like to know which ones are food related, which ones are housing related, and whatever else you want to provide specifically about the things being cut.
I can do that for you. Thank you, Randy.
Thank you.
Amanda?
Yeah, hi, Cindy. Sorry, I have a tic-tac in my mouth. Yeah, thanks for the update about the Health Planning Council. I was the liaison to that for many years, and I always felt like it was a great group and lots of different partners, but, you know, it's always good to rethink something and see if it could be done better. And if there's any input I could give, or, you know, if you want any perspective before I leave this seat, happy to do that. But thank you for that work, because it does bring together a lot of really great people and ideas.
Yeah, thanks, Amanda. You will be missed. And you know, we also have community members, so you might want to, you know, we should keep in touch.
Definitely.
Yeah.
Any other questions or comments for Cindy? Okay, thank you very much, Cindy, for coming today. And we, let's see here, J.R. Claiborne was not able to make it to the meeting this afternoon, as he and some of his staff have annual training, but he did send us an update on what's going on in Veteran Services, and we did forward that to all legislators that are part of the committee. So any other business to come in front of Health and Human Services today? Okay, well, thank you all for attending, and we'll adjourn the meeting.
Thank you.
Thank you.